Doing good? Yes, that's really nice. I could review some of your quizzes in the sense assignments, and most of you are actually trying well, and I really appreciate your effort. Okay, so whereas there are certain aspects where you are going wrong, mainly in understanding what the question is asking for. Okay, and then focusing on the answer. So that is mostly missed in most of your assessment. Okay, so that's really important. See, it's really needed to understand what the question is asking, and then focus on the basically the scenario, understand what the question is asking, and then go with the options. Okay, but how you understand the question, how you focus on the clue words, and but still I mean, so that's more important. But still, even though if you do in that way, there are chances wherein you can go wrong. Okay, so now in this first class, in the first session, what I would like to do is I'd like to bring in a few tips. Okay, a few tips that could probably help you in getting the right answers. Okay, so which you can apply. So in the first hour, I would be discussing a few aspects regarding the ways through which you can crack questions. Okay, so that would be in the initial session, and after that we would be focusing on the next part, that is on diabetes mellitus. Okay, so the condition that we are going to discuss today. Fine. Okay, see, may I get a few like I mean, so comments from your side, so on which aspects you are finding basically difficulty, why you go wrong, what's lacking, actually what's the problem. May I know a few aspects from your side, your view, when you see a question, how are you, or why you get so confused? So I'd like to know from your side. That would be great. Yes, can anyone comment, or you can also unmute and say yes. No answers. Linimore, how are you performing? Drug calculations. Drug calculations. Yeah. Yes, Linimore.
SATA question is difficult for me.
SATA is difficult. Okay, fine. So apart from that, apart from SATA, the normal ones, standalone items, that's okay.
Around.
Mm-hmm.
I'm okay.
Yeah, okay, fine. Thank you. So drug calculations, I mean, if your class on drug calculation is over, so it would be a little easier for you. Those who are drug calculation classes are not over. I mean, so after attending those classes, you can try with the drug calculations. Okay, so where formulas will be explained, and also we would be doing a few questions. Okay, yeah. So, and the drug calculation is basic application of the formulas. That's it. That should be easy. And if you are still finding difficult after attending the classes, please let me know. Okay, yeah. So all are saying SATA. Okay, so SATA, I do understand. So let me apply a few concepts before you, so that you can apply the same in your, I mean, so next time when you do the questions. Okay, yeah. See, I would like to share my screen now. Okay, so the most important thing is believing in yourself. Okay, so believe in yourself, in your ability, and definitely you will be unstoppable. Okay, so most of us are not I mean, so we generally doubt ourselves, in the sense our abilities, isn't it? So that's natural, that's human actually, but we don't realize the potential. So even sometimes when we know our potential too, it could be the comments from our neighbors, or from our family members or relatives and all, can actually put us down. Okay, so and please keep in your mind that you are the one who is going to decide how your career has to be. Okay, it's not your relatives or not anybody else. Okay, yeah, and most importantly, if you believe in yourself, see, if you pass, if you have a better career, also these relatives will be commenting, isn't it? So others will be commenting. So if you go down also, they will be, there are people around us who keep barking all the time. Okay, so that should not be a focus, because a few of you had mentioned me earlier, so not in your batch, in the previous batch and all, so others had mentioned saying that, like, I mean, so they are more worried because most of their the family's eye is on their success. Okay, so that's the worry that's in them. So please keep aside those facts, because you are the one who is going to decide your career, and this exam is not the only one that ends your life. Okay, so you have more things, you have more things to do. Okay, so that should also be in your mind. Okay, yeah, see, this in this process of studying, while doing questions and all, you come across many struggles. I mean, you may tend to fall numerous times, but that's okay. So every time when you do the question, through that you should understand where you went wrong. Okay, so I knew a student who was allotting nearly 4 to 5 hours in a day only to do the questions, but most of the times the questions were not focused, in the sense, out of 4 or 5 hours that she was spending, so more than 3 hours was just to make others understand that, okay, so she is studying. So that was the fact. So see, this is not the way. You are all adults, right? So this is not the way how you need to focus. Even though if you spend 1 hour, so that 1 hour should be completely, you need to be involved there. You need to make notes on where you went wrong, how was the rationale, and why did I go wrong there. Okay, so what did I miss? So next time when you get question, how will I have to focus on that? So all these things you need to understand through each and every question that you do. Okay, and in one question the answer which you opted was wrong, and in the other question the answer you thought was the same. So even though the scenarios were same, so what was the difference there? So why here I went wrong, but why not there? So you should be able to judge. Okay, so what was lacking when you opted every time? So that is very, very important. Okay, so your potential is really, really high than you believe. Okay, trust in yourself, and definitely, I mean, so you should be like a little caterpillar. So I mean, so trusting in your abilities, you should be able to break out with your own abilities itself, and then become a beautiful butterfly. Okay, yeah. So to move further, so let me first give you a few aspects in an NCLEX question. Okay, see, NCLEX question, basically you need to understand, when you get a question right in front of you, understand the anatomy of question. Okay, see here, like every question has got basically 4 parts. One is the scenario. Okay, scenario is the situation which describes, or the background, what we can say. Okay, the other is the stem, and then you are having a correct answer and 3 distractors. So these distractors are the ones which may also be right. Okay, but you will have to focus, but they distract you from the correct answer. So that is the basic difference here. What do you understand by a scenario? In the sense, the setting usually which the client is admitted. Okay, for example, a client admitted in intensive care unit with pneumonia 2 days ago. So setting is there, intensive care unit, pneumonia is the condition. Okay, time frame in the sense 2 days ago. Likewise, you would have seen many questions. A client who underwent colonoscopy an hour before. Likewise, isn't it? So you would have seen the setting in the question, in the scenario. Usually a scenario will have a setting, a time frame will be there. The age of the client will be usually mentioned. Sometimes ethnicity, gender, and most importantly, keywords. Okay, so this is very important, very, very important. Okay, keywords are most important: initial, first action, which you have to intervene. What is the early sign? What is the late sign? So these are all the keywords that you should keep in your mind. Okay, so let me just give you a few keywords, so which you need to always keep in your mind. Okay, especially these keywords are the one that will help you to decide what the question is focusing on. Okay, best, early or late, essential, first, highest priority, immediate in the sense immediately, the very next moment, what are you supposed to do? Okay, yeah. So moving to the next, initial, most, which is the most appropriate action, most likely action, next, primary, vital. Okay, so these are some of the keywords that should be there in your mind, so every time. Okay, so therefore in a scenario, so there is a setting, time frame, age, ethnicity, gender, and keywords. Okay, and at the end of the scenario, there is stem. Stem in the sense, based on the scenario, what are you supposed to answer? Okay, or which question are you supposed to give the answer for? So that is stem. In the sense, for example, this is the scenario. I have shortened it, etc., etc. The nurse is instructing a newly hired nurse to instruct a Foley's catheter. So the scenario will be there that a client was admitted, etc., etc. will be there. Now, what is the stem? The last part of the question is the stem. It would require follow-up by the nurse if the newly hired nurse is observed for, which means that, so in that scenario, what is the wrong thing? So based on that scenario, numerous other questions also can be framed, isn't it? Whereas for this scenario, the question which is given to you is to identify the wrong aspect that is carried out by the new nurse. Okay, in the same scenario can be used for different stem, in the sense they may ask you what is the nurse's most important action, likewise also. So stem will direct you which answer you will have to focus. Okay, the nurse has been diagnosed with 4 clients, etc., etc., etc. Which client should the nurse assess first? So which means that the priority client, out of the 4 clients, which client can be having a major complication or major problem that would require resuscitation or something. Okay, so that is so these are, I'm just focusing on what a stem could be. Okay, see here, so which of the clients are considered to be the highest risk? The last part, it is essential to notify the physician if the client develops what? Okay, so these are the aspects, so that should be focused under the these aspects. Okay, so what the nurses, the last part of the question, so that is what it basically focuses. Okay, yeah. So coming to the strategies in the sense, the most important thing is you should know the questions. You should know the, so you should know the content. Okay, so content in the sense, for knowing the content, see, for example, see, the previous class was on renal system, isn't it? So last Friday. So you have learned about the hemodialysis, you know, like before. So if you haven't learned about hemodialysis, and if you do not know its content, the key inflex points, in the sense, before, always when a client is with AV fistula, what are you supposed to do? So may I get a few answers from your side? When a client is on AV fistula, what are you supposed to check for? Yes,
Thrill and
Thrill and brood.
so you need to check for thrill, brood,
and
isn't it? Yeah, so that's very important. And also you have learned other aspects, like not to take the vital signs on the same side. Okay, so better not to use the same side, but still the client will have to exercise, keep exercising. So all those aspects are the ones that you have learned. So if you had not known those aspects, when it comes to the question, you will not be able to apply the same. So therefore, understanding every aspect is very, very, very important. Okay, so then you need to get back to the question, focus what the question is asking, and then come to the answer. Okay, yeah. So now here, we generally say you will have to critically think and then answer. So that is what is generally said in NCLEX. Okay. So critically thinking in the sense, what do you understand here? What do you understand by critically thinking? Okay. Can you tell me? See, for example, if I'm telling, if you have a client who has undergone total knee replacement, okay, so in you're shifting a client, or he's in the recovery room now. So this total knee replacement who had undergone, and he needs to be shifted to what? Whereas there is no single units, he will have to be shifted to semi rooms or semi-private rooms. Okay. In that case, so if he has to be shifted to a semi-private room, the question would be which room you would be selecting. Okay. So, I mean, there are numerous patients there. For example, to say that could be a patient who is having in the sense he could be having a leg plaster. Okay, so there could be a patient who is who had a recent fasciotomy. Okay, so and also there could be a patient who is having cellulitis. Okay, now I have given here three options. In the semi-private room, there is a patient with cellulitis. So there is a patient who had undergone fasciotomy, and there is also a patient with the leg plaster following a fracture of the femur. Can you tell me this total knee replacement patient would be shifted to which room?
Leg plaster.
Leg plaster? What's the answer? Oh, what's the reason? Why not cellulitis and fasciotomy?
It's more prone to infection.
Exactly. Okay. So because those clients, if you shift, this is a recently, the patient had undergone surgery recently, isn't it? So now he has undergone, and if you shift to the room where a fasciotomy is there, so which is again open, okay, where a cellulitis is there, which is again infection. So this client also can acquire infection. Okay. So whereas plaster cast is closed, therefore the client, if you shift to a room where plaster cast is there, so that is a little more safe. Okay, critical thinking in the sense, sorry, somebody's mic is on, please mute. Okay, so critical thinking in the sense, getting into deeper into the subject, assessing the problem, and then applying the same to the question that is asked. Okay, you had to think when a client is recently operated, of course, the first important aspect that you will be assessing is, you will be assessing the site, you will be checking for infection. That is what you have learned in the theory. Okay, but when it comes in the question, so this is how they present it in front of you. Okay, so you need to think, of course, when a client is newly out from the operation room, so he could be definitely at high risk of getting infection, and therefore I should be placing him in a room where infection is least there. Okay, so that's more important. That is critical thinking, where you transfer the knowledge that you have learned through the contents in the classes, and then you will be applying the same. Okay, so that is critical thinking, and NCLEX focuses only on critical thinking aspects. Okay, for example, we have a question here. A man had a permanent pacemaker implanted 1 year ago. He returns to the outpatient clinic because he thinks the pacemaker battery is malfunctioning. It is important for the nurse to assess for which of the following. This is just a critical thinking question I have put to you. Okay, so can others, so can you give your answers in the chat box based on critical thinking? You know why a pacemaker would be implanted. You know where the pacemaker would be implanted, isn't it? Now, he is thinking, understand the clue words. He thinks that, that is only his thinking. Okay, so there has been no assessment from the, the nurse's side. He's only thinking. So he thinks that the pacemaker battery is malfunctioning. So in that case, it is important for the nurse to assess. Of course, when he thinks something, the nurse, the first task will be to assess. So what you will be assessing for? Is it abdominal pain, nausea, vomiting? Is it wheezing on exertion, cyanosis, orthopnea? Is it peripheral edema, shortness of breath, dizziness, chest pain radiating to the right arm, headache, and diaphoresis? What you would be focusing on? Yes? Fourth one?
Second one.
Second. Okay, can you tell me why a pacemaker would be implanted? He thinks that the pacemaker battery is malfunctioning. Can you tell me why a pacemaker is implanted? If it's wrong also doesn't matter. Think, 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 think. You have not finished.
If the electrical conduction of the heart isn't working, the
I mean,
pacemaker
in bradycardia.
has,
Exactly. Okay. Yes, Amanda. When there is bradycardia, thank you. When there is bradycardia, so actually pacemaker could be can be implanted when the SA node is not functioning properly. SA node is the the pacemaker, the natural pacemaker that triggers the cardiac function, the electrical response. Okay, so only if SA node is initiating impulses, then the deoxygenated blood would be filling the right atrium, and then from the right atrium it will move to the ventricles, and at the same time the lungs action also would be starting. Okay, so that is the main role of SA node. Do you understand? Now can you think and tell?
Third one.
Yes, two. See, abdominal pain, nausea and vomiting. Is there any reason? Abdominal pain. So now
No.
what you should think here? So when pacemaker is not functioning properly, so if pacemaker is functioning properly, definitely there would be no impulses. Okay, so when impulses are reduced, then the right side, the deoxygenated blood would not be filling the heart, isn't it? The right chamber. In that case, what will happen? The deoxygenated blood, when the heart does, when SA node is not there, when that filling doesn't occur, the right side will, so the heart is not functioning. The heart is lost its ability to contract. In that case, so what will happen? There is backflow of the blood to the body itself, isn't it? So if pacemaker fail, pacemaker where we generally keep it? At the right atrium. Okay, so if pacemaker fail, what happens? There will be decreased cardiac output. Okay, so now you need to think, what are the symptoms that I can relate to a pacemaker failure and decreased cardiac output? You have to think in that way, and that is critical thinking. Okay, so if you think about abdominal pain, nausea and vomiting, will it happen for a pacemaker failure? They are gastro symptoms, isn't it? Yeah, they are gastro symptoms, and definitely that will not be present. Wheezing on exertion, cyanosis and orthopnea. Cyanosis and all, wheezing, cyanosis happens in which condition? Tell me. When? Yes, when pulmonary artery is not properly perfusing, so when the blood is not sent properly from the pulmonary artery, and also wheezing happens whenever there is any obstruction in the airway, isn't it? So they are lung related problems. Cyanosis, when does it occur? Bluish discoloration, when does it occur? So when the body doesn't get perfused with oxygen. Yes, when there is some problem with the lungs and all, you can expect the second answer. Okay, what about the third one? Edema, shortness of breath and dizziness. And the fourth one, chest pain radiating to the right arm, headache and diaphoresis. So now three, and so usually we narrow it down to two options all the time, isn't it? So two options we will be usually able to eliminate. And always 2 options will be confusing to us. Now 3 and 4 are there. Chest pain, what does it indicate? Chest pain indicates when do you have chest pain?
MI.
MI, which means that the heart is not getting oxygen properly. Okay, but that is not the problem here. So chest pain will not be present here. Rather, when right side of the heart fails to contract, the blood will backflow, and that will be accumulating in the body, causing edema. Okay, and because of decreased cardiac output, since the heart is not contracting properly, there will be shortness of breath and dizziness. Okay, so that is how you segregate between the third and fourth and end up in third answer, so which is the right answer. Okay, so you have to think like chest pain, when does it occur? When our heart doesn't get sufficient oxygen. Okay, when our heart cries for oxygen, so that is the chest pain is the manifestation of the same. Okay, crying for oxygen is manifested as chest pain, but that is not seen because of, that doesn't happen because of pacemaker failure. Okay, so therefore the important thing that will give us an understanding of pacemaker failure is option 3. Is that clear? So that's how you end up in third answer. So that is something we can call it as critical thinking. And critical thinking comes, so you need to think in that way. Okay, yeah. So moving to, that was one thing where what is critical thinking, how to segregate and all, I wanted to let you know. Okay, the second important tip is that when you get nursing process style question, okay, so nursing process in the sense, so they would be giving the scenario. Okay, but there would be a scenario would be there, and sometimes the complaints of the client would be there. So what is the priority action? In that case, you need to check if there is any assessment in the scenario. Assessment means, what do you understand? Like whether there were any vital signs mentioned, or any assessment or diagnosis was already there or not, you need to check for it. Okay, so if assessment is not there, only the complaints are there, or you identify only the problem, so then the initial thing that you will be doing would be assessment. Okay, for example, you find that the client is on catheter and the urine output is not adequate to the input. Okay, so what's your initial action? Initial action would be checking the urinary tube. Like, so you will go for assessment. You need to identify the problem. So assessment should be always first. So without assessment, you cannot intervene. However important, however prior, so whatever, so how important the case also. So even though it's important, you need to focus on the most important action would be assessment to understand the problem. Okay, so determine if each answer is an intervention or an assessment. So that's also very important here. If there is more than one assessment, so then you can prioritize. Okay, so for example, if I say like in the sense, if you are having this condition itself, this question itself that we had done previously, here this is only the thinking of a nurse, the patient, isn't it? So there is no scenario here. So there is no action here, or the diagnosis or the assessment is not there. So therefore, immediately they gave the next action as it is important for the nurse to assess for which of the problem. So when only the patient's complaint or problem is there, so when only problem is present, the next important step would be to assess. Okay, so that's very important, and that is how you need to think when you get certain questions. Okay, for example, here there are a few assessment aspects. Let us do this question. A client comes to the emergency room reporting nausea, vomiting, and a severe upper right quadrant pain. Okay, so his temperature is 1 or 1.3. There is an assessment. There are 2 assessment points, and an abdominal X-ray reveals an enlarged gallbladder. He is scheduled for surgery. Okay, so which of the following actions should the nurse take first? Now already 2 assessment is there, isn't it? So in that case, what you will be focusing on? Yes.
Determine.
So determine.
Determine.
Fourth one.
That is
Yes,
also
fourth one.
Fourth one, determine whether the client has signed consent for surgery. Or examine the client's health history for allergies to antibiotics. Evaluate the client's fluid and electrolyte status, or assess the client's need for dietary. Which options you can eliminate? Tell me.
First and two.
First and second we can eliminate.
First and second you can eliminate, you say. Assess the client's need for dietary teaching. Yes, so that is right. You can eliminate, because so here, get back to the question. What did you learn here? So always you will have to assess first. Check whether there is an assessment in a scenario. Yes, there is an assessment here. Abdominal, the client complaints are nausea, vomiting, and severe upper quadrant pain. So there is an assessment that says that his fever is very high, and an abdominal X-ray says enlarged gallbladder, and therefore he is scheduled for surgery. Now, before going in for surgery, what is the most important action? So that is the question. Dietary teaching is not the most important, and therefore you can eliminate. Evaluate the client's fluid and electrolyte status. Don't you think it's important?
It's not a first action.
It's not the first action. Then do you think checking allergy is the first action? Or determine whether the client has signed consent for surgery? What do you think so is the first action now? Yes?
Number 3.
Number 3?
Number 4.
Number 4.
Number 4.
No, 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 no. None of these options. You had to think here that, get back to the scenario. The client has come to the emergency room and he has nausea, vomiting, severe right upper quadrant pain. Isn't it? So when he is already...
I think it's number 2. Number 2.
Yes, exactly. So when he's having
Because of the nausea and vomiting.
Because of the nausea, vomiting, he would be having some electrolyte loss. Okay, so therefore, with electrolyte problems, if he is taken for surgery, what will happen? There could be arrhythmias and all, especially because of vomiting, the potassium and all could be low, the magnesium could be low. Okay, so therefore, so the most important aspect, remember always, so if you had finished with the classes of pre and post-operative care, so there I had explained about these aspects. So that is before any surgery, okay, if there are any abnormalities, so that should be corrected first. Remember this one. Then only the client can be taken for surgery. Okay, so before starting with the surgery, abnormalities have to be corrected first. Of course, with fever, you cannot take in the client for surgery. Okay, so but that should be notified to the doctor. If there is already an infection within him, then fever could be the manifestation, that could be normal. But here the client is most probably could end up having some electrolyte problem like hypokalemia. So therefore that should be corrected first. Okay, so then only you need to go in for checking for allergies and signing the consent. Okay, so that was the order how you had to follow. Do you understand? Right? So always remember, so when you have already two things, these things are there, you eliminated this easily because no need for further assessment. Okay, but assessment pertaining to the surgery is important. To the surgery, next you will have to focus on the assessment pertaining to the condition or to the situation that the client is going to face in immediately. For that thing, knowing the client's fluid and electrolyte status is important, and therefore second one is the right answer. Okay, yeah, so focus on these key points under the assessment. Okay, so always assessment points are these: assess before intervene. Remember the nursing process. Words that reflect assessment are ascertain, assess, check, collect, determine, find out, gather, identify, monitor, observe, obtain information, recognize. Okay, so these are the words that reflect assessment. Okay, So remember, so these are the words that reflect assessment. Okay. So evaluating goes under the action. So that is why we are focusing on evaluating the clients. You already have a 2 assessment here. So next you will be going for action. Okay. So that's why, so we are focusing on the second point as the intervention. When already 2 assessments are there, remember the next option as the answer when you have to select, that should be intervention. When no assessments are there, so you should go for assessment only. Is that clear? Okay. So that's what you need to understand here. Please focus on these words. So these are the words that indicate assessment. Okay. Ascertain, assess, check, collect, determine, find out, gather, identify, monitor, observe, obtain information, recognize. So these all are the words that reflect assessment only, not intervention. Evaluate and all will go under intervention. Okay, when already there are 2 assessments in the scenario, go for the intervention. Check every option, whether it is an assessment or an intervention. When already assessment is there, don't go further for assessment. Okay, so if no assessments are there, then you should check for options, whether there are any options that begin with these words: recognize, obtain, observe, and all. So if there are no assessment, then you need to check for the scenario, so the options with these words, okay, in the beginning. So is that
Julie,
clear?
can you please say that again?
Which one?
What you
Yeah, I was telling, like, already, so when there is assessment in the scenario, especially if 2 assessment indicators are there already in the scenario, okay, then you should be, your answer can be focusing on intervention, okay, or the action that you will have to take for that particular question that is asked to you. Okay, but they would be confusing again by putting some assessment, like just like in the previous example. So this one, okay, so here already there are 2 assessment factors here, isn't it? So there is temperature, the temperature is high, and the enlarged gallbladder is there. He's already scheduled for surgery. Now, when already there are 2 assessment factors, what should you be focusing first? You should be focusing on intervention. So assessing the client goes under further assessment. You are not focusing in that way. You are eliminating it. Okay. So evaluation is an intervention. Okay. After you are checking, after implementing something, you are checking that. So examining is an assessment and determining is also an assessment. Okay. So that's that is one of the tip I'm sharing. That's it. Okay. So that's how you end up in intervention here. Okay. So apart from that, so the content, what you have studied says that before any surgery, if there are any abnormalities, that should be corrected. Okay. So therefore, we will be focusing on the evaluation of the client's fluid and electrolyte status. So that is the main thing what you have to focus. Whereas in the sideways, I'm also talking about a few tips. So that will help you to identify what you should select, whether you should go for any assessment factor or when you should go for intervention factor. So when you are confused, when you don't know what to select, then you can apply this tip. That is, if there are already 2 options that indicates assessment, if there are already 2 things that indicate assessment in the scenario, then in the options you will have to focus on an action that indicates intervention. Is that clear, Frankie? Yes? Did you understand? Yeah. Okay. Yeah. Fine. Thank you. We'll move to the next one. Okay. So I'll just erase it. Fine. Okay. So coming to the prioritization. So here, the keywords that indicate prioritization is most important, essential, priority, which means that you have to do something that will be a life-saving implementation. Okay. So you have to think in this way. If there is only one thing I can do before I leave the room, what it should be? And after that is one thing that you need to think. Out of the 4 options for this client with this situation, so he's in his worst situation. I can do only one thing out of the 4 options. And if I do that thing, how will my patient be? Will he be okay? So that is what you need to think here when you are getting those kind of questions. Okay. So you can focus on ABC's safety and relevance. ABC in the sense Maslow's hierarchy of needs. Hope you know that. So wherein ABC in the sense, first you need to understand airway, breathing and circulation. This I had already explained in few of our classes about the airway, the significance that you give to airway, because airway is most important for sustaining a patient's life, isn't it? So then you should be check whether his airway is maintained, and then you to check for the respiratory rate. Okay, so then you should check for circulation in the sense you will go for neurovascular assessment. Okay, whether he has any numbness, how is his capillary filling, how are his pulses. Okay, so that comes under circulation. This should be the priority. If none of these are there in the scenario, then you can think, is there any safety related aspect? Especially safety related questions you will be getting from psychiatry. Okay, so that's very important. Usually you get scenarios of mania, bipolar disorders and all, and what's your best action? You need to think like they would not be having any airway problems, breathing or circulation problems, but they would be having problems related to safety, especially maniac clients and all. You will have to make sure that what I can do to make my client or also what I can do to prevent other clients also from harm, or what can I do to prevent my client from self-harming. So that is what you need to think. Therefore, after airway, breathing, circulation, safety takes up the next priority. That order you need to focus. Okay, but of course it should be related to the scenario also. If you get any dermatology related problem and there is an option that says SS airway, don't select that thinking that in the class it was said ABC I have to give first priority. No, it again depends on the scenario, what they have focused. Okay, so there could be airway safety related options also, but the scenario would be different. Scenario would be where the client is not having any airway related issues. Okay, he could be an elderly person with dementia or Alzheimer's. Okay, so and he might not have any breathing related issue. They haven't given any aspect in the scenario related to the breathing problem. In that case, just focus what is given in the scenario. Don't overanalyze. If you overanalyze, you end up in wrong answers. Okay, so in that case, for Alzheimer's and dementia, what should be my next focus? When airway, breathing and circulation is fine, my next focus will be safety related aspect. You need to think in that way. Okay, so that is how you can segregate the priority based questions. And another aspect that will help you in determining this is knowing the Maslow's hierarchy of needs. Okay, you need to know the basic physiological needs, that is airway, respiratory effort, rhythm, so nutrition, elimination. These comes under the initial aspects. Then comes safety, security, love, belonging, and it goes on like that. Okay, the most important focus should be to airway, breathing, circulation, nutrition. Okay, so nutrition is also very important, keep in your mind. And after that, safety. Okay, for elderly client, when aspects on safety and nutrition comes, select nutrition first. Okay, so is that clear? So just a few things I'm adding side on that will help you to answer your questions. Okay, yeah. So now let us focus on the priority. So I told you, like, so you need to think of these options when it comes on the priority side. So if there is only one thing that you can do before you leave the room, what it should be? Okay, think in that way. Fine. Or if you do that thing, how will be your patient? You need to think in that way. Okay, and you cannot do that. You cannot leave the room without doing that. So that is the another aspect when it comes to especially essential. Okay, that's most important thing that should be done to save your life. Think in that way. Okay, so let us focus on this question. A 21-year-old woman in active labor is admitted to the labor suite. An hour later, the membranes rupture spontaneously. The nurse observes a glistening white cord protruding from the vagina. which of the following actions should the nurse take first? Okay, so this is the scenario. I mean, she's admitted in the labor suit. An hour later, the membranes rupture. Okay, and you can see the cord protrusion, cord prolapse has happened. Now, what she should be doing first thing that, okay, so that she has to do. I mean, so should she come to the back to the nurse's station and place an emergency call to the physician? Administer oxygen by mask at 10 to liter per minute and assess mother's vital signs. Place a clean towel over the cord and wet it with sterile normal saline. Or is she going to apply manual pressure to the presenting part and have the mother assume a knee chest position? What can she do? Imagine the situation. So this is the situation.
4.
4. Any other answer? Prolapsed cord is an emergency. So what you should think here, when prolapsed cord is there, so definitely the mother can end up, so the baby could be having distress. The fetus distress can happen, isn't it? So out of these options, you should also think, is there anything that being a nurse can do? Okay, whether is there anything that I can do which can be done in my scope of practice? Is there anything that can be done that will help in preventing the complication? So if she gets back to the nurse's station and plays an emergency call, by the time the physician comes, the fetal distress would be worsening, isn't it? So eliminate that. That is not the first option. Oxygen, okay, so that could be helping, but is oxygen going to stop fetal distress?
No, ma'am.
No, therefore eliminate that. Okay, so place a clean towel over the cord and wet it with normal saline. What does it do? Is it important?
No, ma'am.
No, rather definitely
Important,
option.
but not,
Yeah.
not.
Fourth one, yes. Fourth one is more important here. So why? Because so when the presenting part, when manual pressure is applied, so that will relieve the compression of the cord. Okay, and thereby so fetal oxygenation will be improved and this will prevent the distress. Okay, and meanwhile she can inform someone to call the emergency, and also so the doctor can be called. Okay, yeah, so that's why. So fourth one is the prior. The question is, what should the nurse take, the first action from a nurse's side? So that is the question that is asked here. Definitely nurse can apply. And also when these kind of questions come, you need to think whether the actions that they have given come under the nurse's intervention or not. So whether a nurse can do it or not, you should also think in that way, okay, to give the right answer. Fine. Yeah, so that's how you answer the priority based questions. Let us focus on one more. A cast is applied to a 9-month-old girl for the treatment of Talipes equinovarus. So which of the following instructions is most essential for the nurse to give to the child's mother regarding her care? Talipes. What is that Talipes equinovarus? Haven't you heard about
Club food. Club food.
club food? Yes, it's club food. Okay, so in club food, what did you learn under club food? What is the management of club food? Cast application, isn't it? So up to what month cast should be applied? Up to 3 months cast has to be applied. Okay.
3 months.
Yeah. So now while you apply cast, what you will be educating the parents?
About the circulation?
Circulation. Very good. So what's the priority action here regarding the care?
To check the circulation by
Number 4.
pressing the
Exactly.
number 4.
Exactly. The cast can, the complication because of the cast would be impaired circulation. Okay. So therefore, so that will help checking the child's circulation goes as the highest priority. Okay, so that is what you need to think. Always remember, when you get client, when you get questions like what should be done first or which client to be assessed first and all, select the patient who is close to death if you don't intervene. Okay, like when you get questions like there are 4 situations, so which client do I have to assess first? Okay, if there are situations like that, when you need to think of which client is at close to death, you need to think in that way. Okay, if you don't intervene, which client will die? So they give questions, right? So there are a list of clients and which client you have to care first. So these kind of questions will be there. To select a client, think in that way. If I don't intervene, which client he will die? You need to think in that way. Okay, and also you need to think, if I give him some intervention, how he will be. You need to think in that way also. Okay, yeah, and especially pain related cases and all, you can if there are nothing else more severe than pain, so then you can select pain. Otherwise, pain can be considered as secondary. Why? Because pain is not going to kill anyone. Okay, so you would be given with scenarios where the post-operative day 1 complaining of incisional pain and all would be there under the options. Remember, because of pain, no individual is going to die. People die so because of hypovolemic shock. Okay, so because of stroke, or because of what else? So because of cardiac arrhythmias and all, if those kind of options are there, so you can focus on that than selecting pain. Okay, if nothing is there, so then pain takes the priority. Okay, yeah. Now, okay, fine. So now coming to SATA questions. Okay, so SATA questions, in the sense, that's really in the sense it's quite challenging, isn't it? So SATA questions. SATA questions, there are certain aspects I would like to explain here. Okay, so consider each question as true or false statements. So that's very important. Consider each question as true or false statement. Okay, so whether each question is so whether that option is true to what they have asked in the STEM or false. Consider in that way each option. Okay, not each question, sorry, here consider each option as true or false statements. Okay, yeah, do not overanalyze. As I said, so if the question is on the client admitted with the COPD, they have given, or for example, okay, so leave that, or a client with a previous history of myocardial infarction. Okay, so a client with a previous history of myocardial infarction has been admitted due to that could be something else they would have given. Okay, so has been admitted following a fracture of the right femur. Okay, so now what are the options or the nurse, the interventions that should be planned by a nurse are? So there could be many SATA questions. Okay, now there are many things which are right to the right femur fracture, like for example casting, immobilizing, and all that could be there, so which you may select. Also, there could be an option provide DVT and thrombo or anti-thrombolysis precautions and all would be there. So is it necessary to give there at that time? So the question was the initial care aspects. Will
No,
you?
ma'am.
No, isn't it? Because sometimes you may overanalyzing in the sense, oh, he has a history of myocardial infarction. In that case, so he may develop the chances of, because of fractures, clot can be released and he may develop clot, and that will cause him problems. So this is where you overanalyze. But the question focused was, what are the initial care aspects that can be applied by the nurse? Under the initial care, you will never be focusing on those DVT precautions and all. Okay, so don't overanalyze in SATA. If you overanalyze, if you just focus, understand what is the question, what they are asking. For that STEM, whether my options are true or false, think in that way. Okay, and watch out for words like always and never, only. If you find in the options these words, directly eliminate that. Okay, so directly eliminate, because usually there is nothing that should be done always, there is nothing that should never be done. So there is nothing that only can be done. Okay, for example, only give grapefruit or only give apples. So if it is there, so you can eliminate. Okay, there could be many other interventions also, isn't it? Similarly, if you have in the options, if there is always, never, only, please watch out for these words. Eliminate those options. Okay, don't select like. Check if the option focuses on what is being asked for. This is very important. This is very important. Okay. So under SATA questions, they will confuse you. Check if the option focuses on what is being asked for. Okay. For example, if I'm telling for example, so the client, the mother was admitted, or the mother who is gestational diabetic. Okay, so she was admitted, and they would have given the question was, or she is in the stage of labor. Okay, so a mother who has who was already gestationally diabetic, so she is in the stage of labor. Okay, so now what are the things that you should be assessing soon after the delivery for the newborn? Okay, so those options will be there. So they would be giving the options like checking the baby's blood sugar level also, and checking the mother's blood sugar level also would be there. Okay, so definitely, so you should eliminate mother's blood sugar level checking there. So because that is known, it's already high, it would be already high. But more importantly, baby's blood sugar level has to be checked, because what you have learned in the theory is gestational diabetic mothers, so the newborns will be hypoglycemic. Okay, so that is what you have learned. So therefore, definitely you should focus on watching out for the symptoms in the baby, so not in the mother there. Okay, so therefore the question that was focused was what all intervention should be carried out in the newborn. And if you selected an option like check the mother's blood sugar level, so that is wrong. Okay, you would have thought the mother is also gestational diabetic, that's why I have to select that. Whereas the question, what did it focus on? The question focused on what were the interventions that should be carried out in the newborn. So check, you are selecting options related to what is asked in the STEM itself. So that's also very important in SATA questions. Okay, so that is another thing. Watch for lab values. This is you have to learn. Lab values, they will give wrong lab values. You need to check for that. You need to learn this. Measurable changes in the client status, like respiratory rate, okay, blood pressure. So all these aspects, they will be changing. Okay, and that's very important. And also measurable changes in the drain volume, output, frequency of monitoring. These all can end up in wrong answers. For example, a client with the immediate post-operative period. So how frequently you have to assess the vital signs in the immediate post-operative period? Yes, in the immediate post-operative period, soon after the surgery.
15 minutes.
Every 15 minutes, isn't it? So every 15 minutes you have to check in the immediate post-operative period. And after that, so you can go for 4th hourly and all. So whereas in the option, a client who had just undergone hemicolectomy, okay, the care things would be asked in the question, and there would be in the option check vital signs every 6 hours. Sorry, somebody's mic is disturbed. It's on. Okay, so there would be option like check vital signs every 6 hours. So that's wrong. You cannot select that. Okay, because the option, the scenario was who had just undergone hemicolectomy, which means that 6 hours one vital signs is not enough, isn't it? So that is how you will have to eliminate. Frequency of monitoring, they will give in wrong ways. You need to check in that, okay, whether the frequency is correct or not. Output, okay, so especially urine output and all. So urine output, they give it as, 60 ml per hour, voided 60 ml per hour. 60 ml per hour is absolutely normal. Lesser than 30 ml per hour is, that indicates oliguria. Okay, so then that could be correct. Okay, for hypovolemia, so that could be correct. So these ways also you need to think. Okay, so that will definitely help you in giving the right answers. Okay, so these are some ways in SATA you need to consider. Okay, consider true or false questions. Consider every option as true or false to the statement. Don't overanalyze. Watch out for words like always, never, only. Check if the option focuses on what is being asked. Okay, I explained this. So check whether you are answering what is asked in the question. Watch for lab values, measurable changes in the client status, and also in the drainage volume, drain volume, output frequency of monitoring. Okay, yeah. So now let us do a question on this. A patient, I want your answers for this, okay? A patient newly diagnosed with COPD. Put your answers in the chat box. This is a SATA question, but SATA is not written here. Please consider this as a SATA question. A patient newly diagnosed with COPD is being discharged home and has a history of diabetes, congestive heart failure, and hypertension. The patient is given a prescription for corticosteroids. Which of the statement below warrants the nurse to re-educate the patient before being discharged home? Which means, what do you understand?
Negative statements.
This is a negative kind, isn't it? Which means what? There are certain things said by the patient which are wrong. Okay, so which of the statement below warrants the nurse in the sense? So there are certain aspects which are wrong, and based on that you will have to re-educate. Which are the wrong statements? Understand the scenario. A patient newly diagnosed with COPD is being discharged home and has a history of diabetes, congestive heart failure, and hypertension. The patient is given a prescription of steroids. Which of the statements below warrants the nurse to re-educate the patient before being discharged home? I will refuse a flu and pneumonia vaccine because it may make me sicker. Is it right?
Yes, ma'am. Need to re-educate.
Consider it as true or false. Think it only that way. You will have to re-educate, isn't it? Okay.
Yes, ma'am.
Yeah, because this statement is false actually.
False.
Because usually COPD clients, so they should be re-educated. So they should be vaccinated. So especially elderly and all, so that they can be prevented from exacerbation of the condition. Okay, yes. So therefore option 1, we are checking for the wrong statements, and therefore option 1 is right there. Okay, so what about the second one? I will quit taking the steroids when I feel better.
Wrong, ma'am.
Wrong, isn't it?
False.
So false. Yeah. Can steroids be taken just like, so can steroids be quit whenever?
No, ma'am.
No. Okay.
No,
So therefore,
no,
so
no.
this is also one answer. Yeah. I will monitor my blood sugar closely. See,
Right,
this is,
ma'am.
Yes.
why? Tell me.
Yes.
Because corticosteroids
right.
can cause
Because
hyperglycemia.
steroid cause
Yes.
hypoglycemia,
Yes.
hyperglycemia.
Exactly. Okay, so this is right, because the patient is given especially with steroids, isn't it? So this here you have to apply your knowledge here. The patient is given with steroids, so therefore he will have to monitor it, because steroids will increase the blood sugar level. Okay, so therefore he will have to monitor, and this is right actually. So you are not considering it under the answer, because they are negative query questions. Okay, I will eat several small meals throughout the day instead of 3 large meals.
Right, ma'am.
So right?
Yes.
Why?
Because ma'am, patient will eat small meals.
Because
throughout
of
the day.
the
Yeah, because COPD client
because
should
the
eat.
COPD patient.
Yes,
Yes.
exactly. COPD client
The
should
COPD patient
be, yeah. If they eat large meals, what will happen? Large means
they
they will,
won't breathe well. They won't
yes,
breathe well.
they have more trouble in breathing. Okay, so they will have more trouble in breathing. So that's why, so they will have to eat small meals. Okay, and of course this is right. It is important to eat slow and stay hydrated.
Yes, ma'am. Right.
Yes, yes, this is also right. So therefore this doesn't come under the answers. I mean the option C, yeah, so C, D and E doesn't come under the answers. Okay, so let us see on the F1. It is normal if my mucus changes colors from clear to yellow. So this is expected. I should only be concerned if it is bloody. So clear, I should only be concerned. So did we find a word there only? Yes,
Wrong.
it's wrong. Okay, so we found a word there only, isn't it? So this only, actually I should only be concerned. That is one thing I told you already. When there is something only and all, you can easily eliminate in the SATA. Okay, so don't consider that. Apart from that, what could be the reason why you have to eliminate that? Yes, clear to yellow. What does that indicate? What does that indicate? Is this expected with COPD?
Infection.
It indicates
Infection.
infection. Very good. It infection. Okay. So therefore, you cannot. So you will have to educate the patient on these options. Okay. So therefore, A, B, F are the negative. So they are the negative options here. Okay, you have to understand the question also. Whenever you are doubtful about any options, for example, I will monitor my blood sugar closely. You selected. You don't know whether to select this or not, because here they have given COPD, CCF, hypertension. They haven't given diabetes mellitus. So you can think in that way. Whereas there is also, you have to read the questions completely. They have also given he has a prescription of steroids, and therefore, of course, the blood sugar level has to be monitored. So therefore, whenever you are having any questions, so underline the keywords. Newly diagnosed. This is the patient is newly diagnosed. That's very important. Okay, and he's being discharged in the sense now he is fine. So always when you get being discharged in the sense, remember that now he is fine. So now he is stable. Okay. And then what is the STEM basically asking us? We are supposed to give the wrong aspects. So regarding the care, okay, so which are the wrong aspects? And that's how, so you end up selecting the answer for the same. Okay, so this is one way. Always remember there are distractors. Distractors actually, especially the distractors, let me just, especially in SATA, you need to know these distractors. So these are some distractors. Entire answer correct except for one word. As I already told you, wrong frequencies of intervention. Okay, early vital signs or early aspiration, something they'll give. So wherein the intervention would be wrong. Focus on that. Okay, so there could be intervention of ABCs, but they are not relevant to the disease. Okay, so intervention is right, but not in the setting. So this is also very important. Okay, the intervention could be right, but the client would be there in a community setting and all. So you should check whether the intervention, whether it is done in that particular setting or not. Okay. Yeah, so symptoms, interventions appropriate when it occurs in different age groups. Sometimes different age, this is also sometimes only, so this okay, you can hold it down, don't confuse a lot. So especially remember these 3 points. Okay, so they are very important. So is that clear? Okay, yeah. So so focus on these aspects. Okay, yeah. So now let me just focus on a few questions here. In the sense, one question we will be doing. We have less time, so therefore one question we will be doing now. The nurse is caring for a client admitted with incomplete fractures of right ribs 5 to 7. The nurse notes shallow respirations and the client reports deep pain on inspiration. What is the priority at this time? What did I say? When it comes to the priority questions, you need to think what's more important. If one thing I can do, what it could be to save the life of my client. Okay, or one thing that could be that will help in relieving the further complication, what it could be. So think in that way. Okay, so when you get these kind of questions, now here what all you have to underline here. So you need to underline that rib fracture, isn't it? 5 to 7 rib fracture. He's having breathing problems. Okay, and he has deep pain on inspiration. Are you going to give IV morphine? Are you going to make him use the incentive spirometer? Or are you going to early use of incentive spirometer? Instruct the client on gently splinting the injury during cuffing, or notify the HCP immediately. So what can you do here now? So what's the most important?
Pain management.
Yes. Now here, yes. Pain management. Exactly. Pain management takes the top role here. Okay. Yeah. So you need to understand, because so when the rib fracture, isn't it? So now pain management and incentive spirometer are the main options that you will have to focus here. So because here, I mean, so yes, like I mean, so like I mean, so this incentive spirometer and all are needed. So that is right. Cuffing, so that's also right. I mean, so the option 2 and 3 are actually right. Okay, but is that the priority? Priority here. So if you give them this, he will not be able to do because of the pain. He has got I mean, so pain in 5 to 7 ribs. Okay, so the pain is so severe. So after you, what is the priority? In order to make him do this, the priority action will be going for administering the prescribed IV morphine. Okay, so morphine will reduce the oxygen demand also. Okay, and morphine will reduce the pain, through which he will be able to do the incentive spirometer and the cuffing exercises, which will help in breathing. Okay, so that is how here you had to focus. Without morphine, the client is telling deep pain. With deep pain, definitely he cannot splint and he cannot use the spirometer, isn't it? So what you should think now here, if they have to focus, these are the priority interventions that should be carried out by the client. But if he has to carry out these aspects, you know, you will have to give the painkiller. Okay, so that's why. So and already it's given as administer prescribed. So it's already prescribed, and definitely you can give that. Okay. So yeah.
Ma'am, if the word prescribed was not there, then would the answer be the fourth or still would be the one?
Then the answer would be fourth.
Okay.
Okay. Yeah. So usually in the your NCLEX exams, they will see that the options would be in such a way that they keep mentioning prescribed. Okay, so I mean, so if the nurse has to administer, in the sense, you know, so especially when it comes to controlled drugs and all, they will mention, they will keep that keyword as prescribed. Okay. Or else, if the question is there, which doctor's order should be followed? Okay, let me make it more clear. So if it was like, instead of what is this priority, if they had given like which doctor's order takes the priority. Okay, takes the priority. If this was there, so then again this prescribed word will not be there. So eliminate this one. Anyways, fourth one will not be there. This will not be there. So you need to read the question and understand how they have put it. Okay.
Yes, ma'am.
Yeah. Okay. Fine. Okay, so that was some of the I mean, so things I had to explain in today's class. Since we have to cover more aspects too, I'm going to wind up the session on tips now. I believe it would have been helpful to you in a at least in some ways to get some tips and to answer. Please apply these aspects while you do the questions. Okay, especially in SATA questions and all. Keep applying the aspects that we had discussed. Make notes of your own tips also. Okay, because see, when not only these tips are there are many other tips. If when you are doing the questions also, you would have come across many other tips that would have been helpful to you. Okay, so is there any such kind of tips which I did not discuss in the class? You can also share here now. Can I get some tips from your side? Yes. If you are happy to share, so we all will be happy. Yes, can I get a few tips from your side based on your practice? What did you identify? What all you found?
Like you said, and there was this tip I got from someone.
Yeah.
If the subjective assessment was given, that means as a nurse, you need an objective assessment. So,
Yeah.
but if the objective is already there, that means you have to move to the action.
That's already I explained. Did you join late, Amanda? I explained this already.
Yeah, but I know, but the stages, if you see like there is a subjective, you have to do the
Objective.
But
Yes,
if
yes.
there's already an objective,
Objective,
then
you
you
can
have
go.
to move straight to the other one.
Yes, yes, that's also very good. In that way also you can consider this. Yes, so you can think in that way too. Okay, so well, thank you for that. Anything else? Okay, yeah, you can think, and even you can share in the other classes also. So in the what all classes we are having in future, you know, so you can give your tips in those classes too. So definitely that would be helping us together to learn. Okay, yeah. So I'm winding up the first session now, and I can give you a 5 minutes break, and we'll be getting back. Okay. Okay. So let us continue with the next part. Fine. Okay, thank you. So the next part of discussion, in the sense, we are going to begin with endocrine system. Okay, the basic so the anatomical aspects of endocrine system and all, are you aware about the same? So what's the difference between the endocrine and the exocrine glands? Any idea? What's the difference between endocrine and exocrine? Yes, any difference? Any major difference? Yes. Any answer? Somebody has unmuted. Are you trying to answer? Yes, I'd like to hear from you, or also you can put your comments in the chat box. What's the difference between endocrine and exocrine?
I mean, exocrine.
Ma'am, endocrine glands
Present.
secrete directly to the bloodstream,
Yes.
and exocrine to the maybe in the ducts, through ducts.
Through ducts.
Duct is present.
Exactly. Okay. So now endocrine, actually they are called as ductless glands, isn't it? So endocrine are called as ductless glands, whereas exocrine glands are the glands that do have ducts. Okay. So now here you need to understand that. So basically endocrine glands are the glands so that releases hormones. Okay, so in order to regulate the activity of the another part or another body. Okay, so now, so these are some of the glands that you should be knowing. Like, yeah, so we are having a few glands here. Endocrine and endocrine glands mainly starts from pituitary. Okay, so pituitary is basically called as the what we can say, the master gland. Okay, so pituitary basically helps in controlling the all the other hormones. Okay, in regulating the hormones, it will make sure that the every hormones are targeting its specific organs or not. Okay, pituitary is the commander, whereas hypothalamus makes sure that so hypothalamus is just like a control center. It will see that every hormones are produced normally, or whether there is any decrease, and based on decrease and increase, our body will be adjusting to that change. Okay, so it's something like that. Hypothalamus is the control center. It will make sure that all the hormones are acting normally, whereas pituitary will be commanding every hormones to target on that particular glands. Okay, so pituitary will be stimulating TSH, it will be stimulating FSH, LH, growth hormones are all released by the pituitary. So therefore it is called as the master gland. Okay, so here so the pituitary's function are actually vast. So we have lots of hormones that are released from pituitary in detail. So we will be learning about these hormones in the next class. Okay, yeah. So coming to the pineal gland. So pineal gland, what it is called as basically? Pineal gland. Pineal gland? What's the significance of pineal gland? Pineal gland helps in regulating the sleep-wake cycle in the circadian rhythm. Okay, so see here, it produces melatonin. Okay, so which is responsible for regulating the sleep-wake cycle. Okay, so if you are used to sleep daily at 11 p.m., by the time you reach 11 p.m. daily, you feel sleepy. That's because of what? What's the reason? So that's because of the melatonin. I mean, so the pineal gland that is regulating the cycle, it gives an instruction to the brain saying that will message you saying that it's time to sleep now. Okay, and when you are used to getting up at 6 a.m. regularly, so every day by the time it's 6 a.m. you wake up without any alarm. Okay, so that is the pineal gland's function. It is responsible for regulating the sleep awake cycle. Okay, yeah, so that is because of the production of melatonin. Melatonin usually gets produced in the darkness. Okay, good amount of melatonin will correctly maintain the circadian rhythm. Okay, so then what about thyroid? Thyroid and parathyroid, okay, I'm not going in detail because we are going to study in the next class about the thyroid, parathyroid disorders. You know, how, of course, how it is helpful. What about this thymus gland? Thymus, do we have thymus gland? Do we have? Yes? Any answer? Do we have? Yes or no?
It's more in children than adults.
It's in children.
I
yes.
think it's in children than adults.
Yes, exactly. Okay. So it's in children. So what does this thymus gland do? They produce lymphocytes. Okay. So that acts as an immune or that gives an immune function. Whereas in adults, I mean, so by the time puberty is attained, you know, this thymus will be shrinking and this will be just converted as a fat tissue. Okay, so therefore thymus, we don't have active thymus gland, whereas children have that. Okay, yeah. Then ovaries, testicles and all, you know, like placenta, how it's helpful. Pancreas, basically two glands in pancreas, exo and endo. Okay, so endocrine glands are producing insulin, glucagon, and exocrine glands are the duct glands. When food reaches the intestine, exocrine, through exocrine, the pancreatic enzymes through the bile ducts, the bile juice will reach the intestine. Okay, whereas endocrine system, in the sense, without, we don't, they do not require any ducts, so they are directed by the pituitary gland in such a way that will be attacking, that will be directly released into the bloodstream and will be attacking only the target organs. Thyroid, when thyroid stimulating hormone from pituitary will be targeting only on thyroid. It will not go and act on adrenal and all. Okay, ACTH will be stimulating only the adrenal gland. It will not go to the thyroid. So likewise, the pituitary will be commanding, and that's for pituitary is called as the commander or the master gland. Okay, yeah. So now in today's session, I would be mainly focusing on the pancreas, wherein we are going to study diabetes mellitus. Okay, so because the hormones that are produced by the pancreas are glucagon and insulin. Okay, so insulin, it is required for raising the blood sugar levels. Okay, and glucagon is required when insulin is required to regulate the blood sugar levels. Okay, so for the cells to absorb the blood sugar, whereas glucagon is required when body has low blood sugar level, you know, so glucagon will be trying to increase the blood sugar level. Okay, so they are the two hormones, major hormones, so that are released from the endocrine gland, and we are going today to focus on diabetes mellitus. Okay, yeah. So diabetes mellitus is a chronic disorder of impaired carbohydrate, protein, lipid metabolism. And this is basically because of the deficiency of insulin. Deficiency of insulin in the sense, it again goes in two ways actually, type 1 and type 2. But let us see how the pancreas regulate the blood sugar level. Okay, so whenever there is low blood sugar level, so what does the pancreas do? So there will be so when there is low blood sugar level, the glucagon are released by the alpha cells of the pancreas. Okay, glucagon gets released and then the liver releases glucose into the blood. Okay, so whereas in conditions of high blood sugar level, when body has high blood sugar level, insulin will be released by the pancreas. Okay, so alpha cells release glucagon, alpha cells of pancreas release glucagon, and beta cells of pancreas release insulin when there is high blood sugar level, and thereby the glucose will be are taken into the blood by the fat and the muscle cells. Okay, so this insulin is very important to open the cells. Okay, so insulin is just like an agent that will be unlocking the cells to receive the sugar from the blood. Okay, see, after we eat food, so the food gets, so the nutrients gets absorbed by the intestine, and the sugar in the food and all gets released into the bloodstream. So this sugar is required for the activity of the brain. For energy, we require calories or sugar, isn't it? So this, but if the cells have to take these calories, or the cells have to take this blood sugar, otherwise it will not be converted to energy. Okay, so to be converted to energy, the cells have to uptake the sugar, isn't it? But if insulin is not there in sufficient amount, the cells are closed. Insulin is like a lock. Okay, so that has to open the cell, and only when insulin opens the cell, the sugar levels will enter into the cell, and then the cell will be utilizing the sugar in the form of energy, or also it will later store as a fat and all. Okay, so this mechanism is very important. Insulin, when unlocks the glucose channel, the cells gets absorbed. Is that clear? Okay, so insulin has to unlock the glucose channel, and then the cells will be getting absorbed. So this is very important, and that's how the insulin works. Whereas people have two types of diabetes. One is type 1 and type 2. Okay, in type 1, what is the problem? Insulin itself is deficit. When insulin is deficit, see, the cells would be fine. Cells will be like, okay, if insulin is there, I will open to get so I will open myself so that the sugar levels can enter inside. So, but insulin is not there. In that case, what I can do? So that's what happens in the case of type 1 diabetes. Whereas in type 2 diabetes, insulin is there, but the problem is with the cells. The cells are not reacting to insulin. Okay, so cells are acting against insulin. So that is the problem in the case of type 2. Okay, type 1, insulin is not produced, whereas in type 2, insulin is produced, but whereas the problem is with the cells. Cells are not uptaking. Okay, yeah. So now, of course, these I will be covering quickly. You know what are the risk factors for diabetes mellitus? Genetic, autoimmune, lifestyle, obesity, poor diet. These are the causes and risk factors. You need to learn this. This is very important. Okay, the lab values for that will help in determining the diabetes status. HbA1c, FBS, glucose tolerance test, RBS mainly. Okay, so mainly you need to know about HbA1c. HbA1c normally should be below 5.7. Remember this. Just before diabetes, it will be around 5.7 to 6.4. Okay, pre-diabetic. HbA1c, how does it tell? Any answer? HbA1c? HbA1c? What's the why HbA1c test is done? Glycosylated hemoglobin, we say.
I'm not sure. I'm not sure, but I can just try.
Yeah, okay. Please.
It's used to like evaluate the management of blood sugar for a long time, like 3 months.
Ma'am, 3 months sugar level. We will evaluate the 3 months.
Like
Exactly.
3 months management. Then it is like the sugar in how much sugar is attached to the hemoglobin.
Exactly.
I'm not really sure, but something like that.
Yes, that's the answer. Okay, so glycosylated hemoglobin lets us know how well our sugar levels are controlled in the past 3 months. Okay, so that is what this glycosylated hemoglobin says, and this should be below 5.7. Whereas borderline diabetic is indicated as when it comes around 6 or 5.8 likewise, and for diabetes people it should be usually 6.5. Okay, so and it should be below that. It should be below that. Okay, so above indicates it's not well controlled. Okay, yeah. So now here under that was about the glycosylated hemoglobin. Know this value. FBS, it should be the normal is below 99. Pre-diabetic 100 to 120. 5, and FBS in diabetic people controlled is around 126, 127 likewise. Okay, yeah. The same thing here, GTT. So GTT, so glucose tolerance test, OGTT test you have heard. Okay, for OGTT test, usually fasting is required, 12 hours fasting is required. Okay, so for OGTT, and after that, the 2-3 samples are taken, and then we check for the level of tolerance. Okay, so that is OGTT, so oral glucose challenge test. Okay, so don't get confused between OGTT and GTT. There are two tests. Okay, so GTT is usually done in pregnant women, or 1 hour GTT we say. So 1 hour GTT is usually done in pregnant women. Okay, so whereas OGTT is usually it will help us to know like how well for this OGTT fasting is required. Okay, whereas for 1 hour GT fasting is not required. Okay, so that is the main difference that is involved here. And for OGTT, usually you give 75 ml of sugar syrup to drink for testing, before testing, and after that testing is done. So whereas for 1 hour GTT, 50 gram of syrup or glucose juice are actually given. Okay, so for testing purpose. Is that clear? So OGTT and GTT. So OGTT, how it is done after the client on he would be on fasting, and after that, so what is done? The first fasting blood sugar level is actually taken. Okay, and after that he will be given with 75 ml of glucose. Fine, and then 2 hours later the blood sugar level will be measured. Okay, so that is done in the case of, and when blood sugar level is measured, so it should be less than 140. So that is considered as normal. So if blood sugar level is more, it indicates that the client can get into diabetes mellitus anytime. Okay, yeah, so that is the difference, and also that is what OGTT says. Okay, how does it works? So random blood sugar level should be always lesser than 200. Okay, so it should always be lesser than 200. Okay, and that was something about the this one. See the laboratory values and all. So this is very important. Okay, yeah. Now the assessment findings, you know, polyuria. Okay, so polydipsia, so increased thirst. So why there is polyuria and polydipsia? Any answer? Yes. When sugar levels are high in the blood, the kidney's resorption is more. Okay, that is why the body gets dehydrated and more urination. When there is more urination, there is more drinking water. Okay, polyuria, polydipsia, resorption. The sugar levels are high, so therefore kidney is resorbing more. The sugar levels are reaching the kidney, which resorbs more and more sugar, and therefore more and more water gets collected in the collecting tubes, causing polyuria. Okay, polyuria, polydipsia, then polyphagia. So these are the prime indicators. Apart from that, hyperglycemia, weight loss is common. So may I know the reason for weight loss? Why weight loss? Yes, why weight loss?
Breakdown of fat.
Because the
Yes.
cells are not getting.
Yes, exactly. The cells are not getting glucose. Okay, so therefore, we, in order to carry out, when cells are not taking up the glucose, in order to carry out day-to-day life activities, there should be, so there should be energy released in some form, isn't it? Where do we get energy if cells are not taking glucose? What then the cells do? So then the bodies, for the purpose of energy, so the body's fat will start breaking, and the byproduct of fat are ketone bodies, and that's why you will find ketonuria also in people who are actually a type 1 diabetic. Okay, so weight loss is very common for mainly for type 1 diabetic, and blood vision, of course, the nerves in the nerves connected to the eye, everything gets affected. Okay, weakness, paresthesias, inadequate circulation, some numbness. You will be the toenails and all could be experiencing some kind of numbness. Okay, so these are all the assessment findings. Okay, yeah. Now here, so you need to know about dawn phenomenon and Somogi phenomenon. Okay, so these are the two phenomena specifically you need to learn here. Dawn in the sense, what does that word say? Early morning, isn't it? Dawn. So dawn phenomenon is rise in blood sugar level as the body prepares to wake up. Okay, I mean, so hyperglycemia when the body prepares to wake up, that is between 5 to 7 a.m. Okay, do you understand? So the body doesn't have insulin here, and excess insulin would not be there. So therefore, so there is hyperglycemia. So especially when the body tries to, or when we try to get up. So that is around 5 to 7 a.m. So this is dawn phenomenon. So at night time itself, insulin has to be taken at the bedtime. So that insulin is called as NPH insulin. As of now, you remember this. I'll come to this explanation later. Okay, so that is in the case of dawn phenomenon. Then what is Somogi phenomenon? Somogi phenomenon is like during the bedtime, the client will be normal or a little high blood glucose level can be present, but hypoglycemia will be occurring around 2 or 3 a.m. Okay, then by 7 a.m. again hyperglycemia. Okay, hypo around 2 or 3 a.m. but 7 a.m. again hyperglycemia. Whereas in dawn phenomenon, early morning only hyperglycemia. Here, early morning there will be hypoglycemia. Whereas after that there will be hyperglycemia. So this all because of the hormone that are released abnormally. Okay, yeah, and here also bedtime insulin has to be taken. Fine. So that is what that was about Somogi effect in the sense sleeping effect. During sleep, what happens? Okay, dawn phenomenon is when the client gets up. So what happens? Okay, yeah. So these are the aspects in regard to Somogi phenomenon and dawn phenomenon and all. Yeah, yeah. So may I know what are the main complication of diabetes mellitus? So what is the problem when diabetes mellitus is there? So, I just want to know if there is increase as well as decrease. What is the problem? Decrease will cause what?
Shock.
Which is more dangerous, decrease or increase?
Decreased.
Yes, exactly. Okay.
Decrease.
Decrease is more dangerous, isn't it? So let us see hypoglycemia signs. Okay, what are the signs of hypoglycemia? Mainly, if the blood sugar level is around 70, 75 and all, so these problems will be there. Like all, so hunger, nervousness, palpitation, sweating, tachycardia and all you will be finding. So if it is lesser than 70 and around 55, 60 and all, see, the brain requires continuous supply of glucose, isn't it? So brain cannot store glucose. Brain always require continuous supply of glucose. Now, when glucose supply is stopped to the brain because of the less glucose in the body, all mental related problems will be manifested. Okay, like confusion, drowsiness, headache, and all these problems. Okay, so all mental related problems you can just think: confusion, drowsiness, headache, and all. Okay, so in severe, then further moving severe in the sense it will be lesser than 50, the client can go into what? Into a coma also. He will be totally loss of consciousness also can happen. Okay, yeah, so that's the something you need to know about the symptoms associated with mild, moderate and severe hypoglycemia. And what is the management, tell me, for mild and moderate? Any answer? What's the management for mild and moderate? Think.
Dextrose.
Giving sugary
Local sugar.
Yes,
giving sugary drink.
Sugary drinks can be given, isn't it? So what is the management for severe?
Dextrose. 50% dextrose.
Dextrose, 50%
Dextrose.
dextrose or glucagon.
Exactly.
Glucagon.
Okay, so 50% dextrose or glucagon is the choice. Fine. So that's what we need to give here. Yeah. So they are the major complications. Okay. So now let us see specific complications in type 1 and type 2. So type 1, the main complication is DKA, diabetic ketoacidosis. See here, this occurs when the blood sugar level is very, very high. Okay, so when the blood sugar level is very high and the body doesn't have sufficient glucose, lack of insulin or reduced dose or missed dose of insulin can be causing diabetic ketoacidosis. Okay, now here, when a client has diabetic ketoacidosis, so these are all his assessment findings. Acidosis in the sense the pH is reduced, the bicarbonate is getting reduced. Okay, acid is getting more and more formed. Hydrogen ions are getting formed. So therefore, acidosis is acid is getting accumulated in the body because of the increased fat breakdown. Okay, so and this will cause a different order in the breath. That is Kussmaul's respiration we skip. Fast breathing followed by fruity breath. Okay. Then there is nausea. Remember these points. Abdominal pain is there in DKA. Dehydration, see, because the kidneys, so the body is trying to reabsorb everything and body will have dehydration. Electrolyte loss. Okay. Electrolyte loss in the sense the electrolyte, mainly potassium, will be shifting and there is increased potassium level, hyperkalemia. Remember, hyperkalemia occurs when there is dehydration. So there is hyperkalemia. Okay, yeah. So polyuria, polydipsia, because of the electrolyte shift, weight loss. So these are the signs you will be noting in the case of diabetic ketoacidosis. Okay, now mainly you will have to remember some points. Okay, so that is like one thing is 2 aspects of DKA you need to remember. So they are, one is dehydration and hyperkalemia. Dehydration and hyperkalemia is the major problem here. So our focus is to correct dehydration and hyperkalemia. Okay, remember here the insulin is totally insufficient and the blood sugar levels are very high and also the client is dehydrated. When the client is rehydrated itself, he will try, so the blood sugar level can come back to normal. Okay, so mainly you need to restore the circulatory volume and protect against cerebral, coronary and renal hypoperfusion. Treat dehydration. This is the major aspect here. IV infusions and dextrose is added to the fluid and also insulin will be started through insulin pump. Okay, so but when this is done, so when this is done, so there are 2 other complications that can arise. That is hypokalemia and cerebral edema. Do you know why? See, when client is having dehydration, his potassium levels are very, very high. Okay, because potassium is basically intracellular component and when fluid leaves the body, electrolyte will be coming outside and therefore the potassium level will go high. Okay, so dehydration and hyperkalemia are the major manifestations or the problem that you see there, and therefore we will, as a part of treatment, you start rehydrating the client with dextrose, with a normal saline, and insulin pump will be started. But when the client is rehydrated, so rehydration has to be done rapidly. When he is rehydrated, so the potassium level will start falling. Okay, it was high. That was because of dehydration. When he is getting rehydrated, the potassium level will start falling. Okay, and sometimes the blood sugar level may not come to normal. In that case, they will continue insulin and fluids and all. Then if it is continued, the potassium level will further fall, causing hypokalemia. Okay, that is one complication. Second one is the fluids are rapidly sent into the body and because of the process of osmosis, the fluids will be pulled into the brain, causing cerebral edema. These two are the complications of treatment of that because of the treatment of diabetic ketoacidosis. So you should be monitoring for these. When a client is rehydrated, his potassium levels to be checked. Okay, and if his potassium level is getting to normal during the time of dehydration, and during the time of the rehydration, he should be started with the potassium injection administration. Okay, so that because if potassium goes down, further cardiac dysrhythmias will be happening. Okay, so is that clear? And also, if there is cerebral edema, so how can you identify the manifestations? What manifestations you will identify for cerebral edema? Cerebral edema will be causing what? Raised intracranial pressure, isn't it? For raised intracranial pressure, what are the manifestations? Yes,
Headache,
Nausea, vomiting, loss of consciousness.
loss of consciousness.
mental status changes.
Altered.
Exactly. Exactly. Okay, so they are the indicators of this thing. Right. So please remember these points under the interventions. So you will be treating hyperglycemia with insulin administered the IV. Okay, so then electrolyte imbalances have to be corrected. Potassium level may be elevated as a result of dehydration. Therefore, potassium level should be monitored slowly, and that will be decreasing when the client receives treatment for dehydration and acidosis, and that may require potassium replacement. Okay, cardiac monitoring is also required because so of the risk associated with the abnormal serum potassium levels. Okay, so that was about the diabetic ketoacidosis. Now there is another problem that usually occurs in type 2 diabetes mellitus, that is hyperosmolar hyperglycemic syndrome. Yeah, so before moving to that, there was on one more slide here. So please note here, the potassium level will fall rapidly within the first hour of treatment. Okay, so that's very important. In the first hour itself, so you should monitor for the potassium, should keep continuously monitoring for the potassium level in diabetic ketoacidosis. Okay, moving to HHNS. See, HHS is hyperosmolar hyperglycemic syndrome in the sense the blood sugar levels will be going so high, but this is gradual process. DKA was all of a sudden. Okay. Whereas HHS is gradual. Slowly the blood sugar level will rise. It can go to 500, 600 also. This happens in type 2 diabetic people. Okay, but they do not have ketosis or acidosis. Do you know why? They have only high blood sugar level. Usually they will not have ketosis or acidosis. What could be the reason for that? Yes? Because
of the presence of insulin.
Exactly. Insulin will be suppressing the formation, the acidosis and all. Okay, so acidosis, ketosis will be suppressed by the insulin. So they have insulin, so therefore they do not experience ketosis and acidosis. Okay, so whereas they will be having high glucose level, and this is gradual process. DKA was all of a sudden. Okay, any stress in DKA, the causing factors for DKA are any stress or any infections or decrease suddenly eating large amount of sweets, and all could be the causing factors for DKA. Is that clear? Okay, yeah. So the symptoms are the same as we discussed, like blood sugar level will be going above 600 mg per dl. Okay, so these are some evident differences between DKA and HHS, like glucose. So this is 13 and all are in the forms of grams per dl, 250 to 600 and all in the form of mg per dl, the units. Okay, so this is how it differs, and that's it. Mainly you need to know about the sugar levels, and usually like acidosis will be experienced in DKA, but here no acidosis. Okay, so that is the difference here mainly. Fine. Again, the tree, yeah.
Regarding the gradual increase of sugar in 8HS, how many hours will it take, then it will increase? Like you said, it's gradual.
Gradual in the sense it can take days also. Okay, so it can even take days. Yeah, not only hours. Okay.
Okay, thank you.
Yeah. Fine. So the treatment is the same. Okay, rehydration for both for diabetic ketoacidosis. Usually for HHNS, without insulin only they can get back to normal. When they are just rehydrated and all, they can get back to normal. Okay, whereas for diabetes ketoacidosis, but insulin is given as treatment, but I'm just adding an extra point there. So whereas the treatment is the same for us, whereas for diabetic ketoacidosis, so they should be both started with fluids as well as insulin. Okay, yeah. Now, the complications of diabetes mellitus are retinopathy, nephropathy, and neuropathy, isn't it? So you know about this. So the retinopathy, nephropathy, and neuropathy. Retinopathy in the sense retinal circulation, eye, there is change in vision. Okay, so how can you control retinopathy? Tell me. How retinopathy can be controlled? How retinopathy can be controlled?
Proper
I check up.
Eye checkup.
proper management of control of blood sugar.
Control of what?
Laser therapy.
Controlling the
adhering to controlling your blood sugar.
Mainly controlling the blood sugar level. Very good. Okay, so by controlling the blood sugar level, so this can be controlled very importantly. Okay, and also you should control the hypertension also. That's also needed here. Okay, so controlling hypertension is also very important. Fine. So that is in the case of retinopathy. So what about nephropathy? Nephropathy, see, in retinopathy, change in vision is identified. So that may indicate that could be because of diabetes mellitus. In nephropathy, what problem you will be finding? In nephropathy, what would be the problems? Increase in what levels and all?
Creatinine
level
high. Creatinine level.
One.
Filtration.
Increase in creatinine.
Exactly. Okay, so increase in creatine levels. Okay, so increase in creatine levels and all, mainly you will be finding, and even albumin. Albumin can be present. Okay, yeah. So then what else? Like in the case of neuropathy,
the numbness of the leg, tingling.
Yes, exactly.
Tingling
okay,
and numbness.
Yes. There is some problem, I think so. Yes, numbness in the legs and all. So that is the problem. Okay, yeah. So now here, so food care based questions you can get. Food care. So what aspects you will be considering under food care? Can I get answers? Because they are easy, isn't it? So what kind of shoes you will be asking the clients to wear, whether it is leather or plastic shoes?
Should be leather.
Leather.
Non-skid shoes. Non-skid shoes. And leather.
Yeah, leather shoes. Leather. Yes. Okay. So leather shoes are usually preferred to plastic. Okay. And good cotton socks. And never place any hot water bottles or heating pads to warm the feet. Okay, remember this. No hot water bottles and all can be kept on the feet because it will cause damage. So therefore, and also one more thing is that if sensation is less, the client may not realize how much heat is being affected or produced. Okay, so because sensation, the decrease in sensation for neuro problems, decrease in sensation begins from toes. Because when perfusion decreases, perfusion mainly decreases in the toes, and therefore decrease in sensation begins from toes. So therefore, if the client has numbness and all, and on top of that, if he keeps hot water bottles and all, he may not realize the heat being produced, and he may end up damaging the skin. Okay, so therefore no hot water bottles, heating pads and all are usually not given. Okay, no prolonged sitting, standing. Nail care also, you should see that the trimming of the nails should be straight. Okay, not with cuticles. Okay, so that is not encouraged, and in these ways the care has to be provided. Okay, yeah. So that was about the complications. So now we are moving to, yeah, and
Julie,
anything else?
sorry.
Any,
I have a question, please. I have a question about the cutting of the nail. I saw like two disparities. Who should cut the nail of a diabetic patient? Can the relative do
Okay.
it or the podiatrist?
for podiatrist. Relative can be, see, so
So
if
the
the
relatives
relative
can't.
is doing, so he should be instructed properly. See, relatives can't. Relatives with the proper instruction can be cutting the nails. Okay, so they should not damage the cuticles. That is the problem. Okay, yeah.
Because I saw a
So,
question
fine.
relating
So
to that.
let us move
and,
to the. Sorry.
I saw a question relating
there
to
was
that,
some break.
and somewhere else I saw. Hello.
Yeah. I'm getting
Hello?
now. Yes.
I just want to know because I've seen a question relating to that, and I've seen it somewhere else, and it was saying the same thing. So I want to just get clarified. So a relative can cut a diabetic patient's leg? Must it be
there was some
a
disruption in.
specialist?
Yeah,
I mean,
podiatrist, usually they will be
it
referred to the
mustn't be a
podiatrist. See, it
specialist,
again
right?
depends on how the Amanda, there is I can't hear what you are saying. There is some disruption in the internet. There is some lag.
I said, must it be a specialist, or must the relative, can the relatives or the patient cut his or her nails?
Is anyone getting what she's telling? I'm getting a big lag. Or are you experiencing the same problem?
I think what she means, ma'am, is that she saw a question asking like who will be the one to clean the nails, like the family member or the podiatrist.
Yeah, she's trying, but I didn't get that question properly. Could you type in, Amanda? Like I understood the initial part, whether it's a specialist or any relatives can cut. It again depends on how the scenario is put in there. Okay, see if the client has really neuropathy, and then of course the relative cannot do all, he should be referred to the podiatrist. Okay, so and suppose if if he's just been normal and all, so he can be educated regarding the cutting of nails, and of course the relative also can practice the same. It all depends on how the scenario has been put up. Okay.
Okay, thank you, Julie. Thank you.
And ma'am, can if the patient is
so
in
I
hospital,
hope she has got yeah. Okay, so we'll continue.
Ma'am, I have a question. Like if a patient is in hospital, it is still a podiatrist or still a primary caregiver can cut the nails and all?
Yeah, that can be done by it again depends on the availability. Okay, on the risk and availability. And primary caregiver can do that, right? No problem.
Thanks.
Yeah. Okay, so we'll move to the next aspect, a very important one. We are going to discuss about the insulin administration. Okay, so under the insulin administration, learn this now itself, here itself. Okay, I don't want you to forget. So under insulin, mainly there are flow classification, rapid acting, short acting, intermediate acting, and long acting. Okay. So learn the onset and peak hour. So that's very important. Based on that, numerous ways the questions can be twisted. Okay. Rapid, some of the brand names are Novolog, Epidra, Humalog, and all. Okay. So insulin, Aspart, Lispro, and all come under rapid, and the onset of action is within 15 minutes. Short acting, the onset, see this rapid acting will stay in the body for only around 1.5 hours. So therefore, usually it's not recommended very frequently, but more commonly short acting and intermediate acting are usually used. Okay. Under short acting, Humulin R. So if there is a brand name that has got an initial R, you know, so then that is a short acting or regular insulin, we call it as. And intermediate acting insulins are called as NPH insulin. Okay, so regular and NPH insulin. Okay, so regular and NPH insulin. So please note that. Fine. So this regular insulin are Humulin R, Novolin R, and NPH insulin have got an initial on N called as N. Novolin, Humulin, and R. Okay. So this short acting's action will begin from 30 minutes. So and it will stay up to 1 hour. And I mean, so the onset, whereas it will be staying for around 4 hours, and whereas intermediate, the action begins only after 1 hour. And the peak action will be at 8 hours onwards, from 8 hours onwards. Okay, it will be staying in the body for around 12 to 16 hours. So 12 to 16 hours, whereas rapid acting will be staying in the body for around 5 hours only. Okay, so short acting can stay up to 8 hours, whereas intermediate acting can even stay up to 16 hours in the body. Whereas the peak action differs. Please learn the peak action. For short acting, for the peak action is between 2 to 4 hours. Peak action is the period where the client will be experiencing hypoglycemic effect. Okay, where the blood sugar level can go down, and that's the time they should have their food properly during the peak time, because otherwise they can end up in hypoglycemia. Okay, so peak hour is the hour where the insulin's action is maximum. So therefore, the client can have hypoglycemia. Is that clear? So intermediate acting peak hours is for around 8 hours. Okay, so you should know here. So please go through these slides. Short acting peak hour is from 1 to 5 hours. Intermediate acting peak hour is from 6 to 14 hours. Okay, so please learn this. And long acting does not have any peak time. So it is just given to maintain, like it will stay in the body for 24 hours. Okay, so long acting like Lantus and all come under long acting. Lantus and all come under long acting. Is that clear? I believe you have learned this. Please know the 4 categories. R insulins are short acting, N insulins are intermediate or NPH. Okay, long acting insulin also we have. Now, so this insulin administration usually where the insulins are administered in the body, like in the sense of the regions, these are the sites. Okay, so please know the sites. So upper outer arms, abdomen, buttocks, upper outer thighs, and this should be rotated. The site should be rotated. So that is very important. Okay, if sites are not rotated, what will happen? They will end up with lipodystrophy. So this is if in one region only, if the injection is given, so this will happen. Okay, lipodystrophy. See here, you can see some allergic reactions of insulin and all. So lipodystrophy, this is lipodystrophy. In order to prevent this, the sites of the insulin has to be rotated. So that's very, very, very important. Okay, so that's rotation of the insulin is very important. Is that clear? Okay, so now getting back to the point of discussion here. So as I already told you, so this insulin, there are some aspects under the storing of insulin also. Okay, storing of insulin in the sense, may I know where the insulin has to be stored? How the insulin has to be stored? Any idea? Yes, where can you store it?
Refrigerator.
Cool dry
In,
refrigerator.
in cool areas, yes. Exactly. In cool areas, you can no direct. It should not be exposed to direct sunlight. Okay. So in cool areas only you are supposed to store the insulin. Fine. Okay. Yeah. So coming to the insulin, I mean the back to this part. So there is something called as mixing of insulin. Okay. So insulins are usually mixed. Sometimes you get that pre-mixed vial itself. Mixing is usually done between short-acting and long-acting, short-acting and intermediate-acting insulin. Okay, because why this mixing is done? See, when it is mixed, you know, the action also will be immediate and the effect also will be sustained. So that is why it is mixed. Okay, see, when regular and intermediate insulin are mixed, the action will be beginning within 1 hour, and it will the peak action will stay up to 6 to so it will stay up to 6 to 14 hours also. So that's why in clients who are having very high glucose levels and all, they are given with pre-mixed insulins. Okay, or in order to get the best effect, we can mix it separately also. So based on this mixing, you can get questions. Okay, so remember, I would like to contribute a few aspects here, so which is very important. When the doctor advises to mix the insulin, short acting insulin should be drawn first. Short acting should be drawn first, followed by then long acting. Okay, so short acting, then intermediate acting. Okay, so intermediate acting. So this you should remember. Short acting in the sense, when you are drawing in a syringe, when you are drawing the insulin, first the short acting should be taken, then NPH. So when you administer, first NPH will go, followed by short acting. Okay, so that is how it should be there. So but sometimes you may ask, like, don't it get mixed? No, it usually doesn't get mixed. So you have to administer soon after drawing. So you have to administer this. So within 5 or 15 minutes, within 5 to 15 minutes, you have to administer. It doesn't get mixed. Why? Because regular insulin is usually clear in color. This short acting is usually clear in color. Okay, and this NPH insulin is usually cloudy in nature.
color.
Yes, so therefore it doesn't mix. Okay, so for example, if let me say the doctor, usually the ratio will be like 70/30 likewise. Okay, just imagine now you are getting a prescription where the regular insulin has to be around 6 units. Okay, and the NPH insulin has to be around 25 units. So this is the prescription. Okay, you need to pre-mix it. So first, what are you supposed to do? First, you should add this. That is 25 plus 6 is how much? So 31. Total units are 31. Okay, so now what are you supposed to do? You should take the insulin syringe, okay, and draw the 31 unit. But before that, hand washing all has to be done. Okay, the vials and all should be properly rotated properly. And after that, the total amount of air. So air should be drawn first. Why? What is the reason of drawing air? Tell me. What happens when air is not drawn? Any idea? Yes, why air is drawn? For any injections, you actually draw air, isn't it? So why air is drawn? Yes?
To be sure that you did not
For accuracy.
Accuracy, yes, exactly. To when air is drawn, you know, the accurate amount of medicine only will be will be pumped into the syringe. Okay, so that is for accuracy. Okay, so that's why we need to draw air first. Now first, what do you do here? So the doctor has prescribed 6 units of short acting, 25 units of NPH. So in one syringe, the total 25 plus 6 is 31. So you will be drawing 31 units of air first. Okay, so then what you do, you insert the syringe into the short acting. Okay, because we have learned that the short acting should be drawn first, isn't it? The short acting first, then intermediate acting. So first, first you will be what you'll do. So you will draw the air first. Okay, but you should make sure the short acting amount is there first drawn and then the long acting. Okay, but you are having total 31 units of air. So what you will then do after drawing 31 units of air, so you will be injecting 25 units of air so into the long acting bottle first. Okay, so then you will withdraw the syringe, then go to the short acting bottle, inject the remainder 6 units of air and withdraw the same 6 units of insulin. Okay, then you go to the intermediate acting vial and then you will be withdrawing the remaining 31 units of the remaining 25 units of the insulin. Okay, so did you understand? For example, so let me give you another example. So you have the doctor's prescription says 10 units of regular insulin, okay, and 25 units of NPH insulin. So you need to mix and give. So what do you do first? 25 plus 10 is 35. You have to mix it, isn't it? So 35 units of air will be drawn first. Okay, so then what you do after drawing this 35 units of air, 25 units of air will be inserted first in the NPH vial. Okay, so 25 will be inserted in the NPH vial, remaining 10 will be inserted in the regular vial, and then that 10 will be immediately withdrawn also. After that, again, you will be getting back to the NPH vial to withdraw the remaining NPH, the insulin. Okay, so that is how you do the pre-mixing of insulin. So is that clear? So that will be staying separately. The regular and the NPH will be there separately itself in the syringe. It don't mix because of its nature. One is clear and one is cloudy, but you will have to administer the injection immediately to the client. Okay, so otherwise it will start mixing up. So that when this is administered, the regular action will be starting within 1 hour. In 30 minutes, the action begins, and the peak action will be after 2 hours, the peak action will start. And by the 4 hours, when peak action is reduced, the NPH will be taking over to act on. Okay, so that is why to give a sustained effective effect on the high blood sugar level patients, so the mixing of insulin is usually recommended. Okay, so is that clear? So was it clear? Confused? Any doubts here? So if you are having any doubts, you can ask me. Are you clear about the mixing?
Yes, it's clear.
Yes, yes. Okay, fine. So moving to the next aspect. So please learn the PCARs. You will be getting questions based on this PCARs. Okay, yeah. So moving to the next aspect, you should know some anti-diabetic medications too. Like for type 2 clients, the medications that are usually given. Okay, so there are important points we can just learn. So biguanides. So under biguanides, mainly metformin kind of drugs would be coming. The main problem with metformin is it will be causing acidosis, especially before any dye insertion procedure. Metformin should be stopped. Okay, so that's very important. Otherwise, acidosis is the major problem with this biguanides preparation. GI distress, mainly GI distress also is caused. GI distress and acidosis is the major problem here. Okay, you should be monitoring for that. And the second generation sulfonylureas. Remember, it's sulfonylureas, not sulfonamides. Okay, sulfonylureas. Sulfonylureas usually, again, it will cause hypoglycemia. That's it. Okay, and also disulfiram-like reactions. Disulfiram reaction. So this you will be learning in psychiatry. Disulfiram reactions, and the medications also I had explained about this disulfiram like reactions, in the sense when sulfonylurea like glimepiride and all is taken, and if alcohol is taken, along with this, the client will develop severe reactions, nausea, vomiting, and all. Okay, adverse aversion. So will develop. So that's why disulfiram reactions are seen with alcohol when sulfonylureas are taken. Okay, yeah. So and meglitinides. So that's it, nothing more. They are the other categories, and also gliptin kind of drugs are there, sitagliptin and all. Gliptins, okay? So gliptins, remember these? Under gliptins, sitagliptin, sexagliptin, teneligliptin and all. So what they do is they make sure that the insulin gets released properly, okay? And also, so this gliptin, but this gliptin usually reduces the fasting blood sugar levels, okay? FBS gets reduced with this gliptin. So that's it. So they are the 3 or 4 anti-diabetic medications, so that you need to remember. Okay, yeah. So now that was all about the diabetes mellitus. So now let me assess how much you have understood. So based on the classes that we have discussed. Okay, yeah. So I would like to open a few questions on diabetes mellitus. Okay. The emergency department nurse cares for a client admitted with diagnosis of hyperosmolar hyperglycemic state. The nurse understands which characteristics are commonly associated with this complication. So these 2 points are there, okay? One is abdominal pain. So this is the second point. Blood glucose level greater than 600. This is the third point. This is the fourth point, and this is the fifth point. One is there. Abdominal pain. No.
Second one.
Yes, second
Third.
one.
Third
Yes.
one.
Second, third. That's it. Don't you find neurological manifestations?
Yes, ma'am.
Yes. Yeah,
Yes.
neurological manifestations is very common. Okay, so that is usually there in all, like neurological manifestations such as blurred vision. Okay, so those kind of symptoms are seen when blood sugar level is high, isn't it? So therefore, even fifth one is the answer. Second, 2, 3, and 5. DK and in DK you will be finding abdominal pain. Okay, yeah. So moving to the next one. In the ICU, the nurse cares for a client who has been admitted with DK. The client is on a continuous infusion of regular insulin at 5 units per hour via IV pump. Which action should the nurse expect to implement? Which one can I get the answers?
Last one, ma'am.
Last one?
Yes.
Why?
Because
Why?
because it may cause hyperkalemia.
It can hyperkalemia or hypokalemia?
The answer
Hypo.
is two.
Not 2.
Hypokalemia. Sorry, ma'am.
Exactly. So you should note here. So in ICU, the nurse he's having DK, diabetic ketoacidosis. Okay, so regular insulin, he's on, see these points, that's why I ask you to underline the clue words. He's on continuous infusion in the sense now also, so that's going. So in that case, what you are supposed to do, check bun creatine. So this is not needed once in a, that too not every hour. Okay, so because he is not having any nephro problem, so creatine levels are not needed here. So discontinue insulin when blood glucose level is 350. If you discontinue insulin, this 350 is still high, right? What's
Right,
the
ma'am.
reason to discontinue? So no.
No.
Increase insulin infusion rate when blood glucose level decreases. No. Okay. So rate wise should be increased when blood glucose level decreases. Whereas initiate potassium IV when serum potassium is 3 point. This is normal, right? But since the client is on continuous insulin, further continuous administration will reduce the insulin level. Will reduce the potassium level. Okay, so that is why, so potassium has to be started. Fine. Remember, the main treatment for DKE is fluids. Okay, fluids, and then insulin, and this one, potassium.
Potassium.
Okay, so that's the main treatment for DKE. Fine. Okay, so we'll move to the next one. A client with type 1 diabetes is on intensive insulin therapy. The client is of the Islamic faith and insists fasting during Ramadan. What is the most important nursing action? See here, this is a question where only there is no assessment. He wants, there is only subjective aspect. Okay. So as Amanda said, subjective aspects are only there. So there is no objective. He's telling that he needs to be on fasting, and you know that cultural aspects definitely we need. Yeah, Lini, your daughter has got a good voice. Yes. Please mute. Yeah. Okay, so remember here the client is on Islamic faith and insists fasting during Ramadan. See, cultural aspects, of course, you need to consider. Fasting is considered as the main thing, a main ritual that is practiced during Ramadan, isn't it? So therefore, he's of Islamic faith, and but he also has type 1 diabetes mellitus. In that case, what you will be doing? Yes, assessing the client's clinical. Very good. Okay, so here, why? Because so before, see, what does the option 1 say? Advise the client of the risk of fasting when diabetic. Yes, you have to do this. I'm not saying no. Assess the client's stability. Yes, that's there. Refer to the HCP for adjustment of no. So that's not okay. Why do you have to refer to the HCP? All of a sudden, the dose cannot be reduced or increased. Okay. Before that, something else has to be carried out. Refer the client to the registered dietitian for a meal planning. See, he has to be on fasting, and how can you refer to the dietitian? So these all are, these two options 3 and 4 are the ones you can easily eliminate. Okay, so whereas when we consider 1 and 2, definitely the second one takes the priority because there is no other assessment factor there. So before you advise or before you decide on something, the client's clinical stability has to be assessed to know whether how stable is his, how was his HbA1c, how is this, all these assessment data has to be collected, and then he can be, based on this clinical stability, further interventions are carried out. Okay, so he should be checked for the history of hyperglycemic episodes. Okay, so he should be checked for his so how well he's able to check his blood glucose level during fasting, whether he knows that. All those aspects should be assessed. Okay, and after that only, so you can allow for the clinic, this one, fasting. Okay, so therefore second one has to be taken into the first prioritization. Okay, yeah, good. Okay, a client is brought to the emergency department in an unresponsive state Underline this. And a diagnosis of hyperglycemic, hyperosmolar, non-ketotic syndrome is made. The nurse would immediately prepare to initiate which of the following anticipated physician's prescription. See, yeah, this is what all these prescriptions are there. Okay, ET tube is also there, 100 units of NPH is there. So IV normal saline is there, sodium bicarbonate is there. What are you going to begin the client with?
Third one.
Third one?
Yes.
Why? Why can't first one? He is unresponsive state, right? So he's unresponsive. Then why can't you go for ET? Intubate the client?
One.
One?
Yes.
But what is his diagnosis?
There is no indication of respiratory distress.
I don't think there is no need for there's need
intubation.
for intubation.
Yes, there is no need for intubation because yes, respiratory distress is not there and the diagnosis is HHNS. The client
And
became unresponsive due to high, so because of the, yeah, so high blood sugar
blood
level.
glucose.
Yeah, so that's why. Okay, so I'm getting my echo. Somebody's, please mute your mic. Just a minute. Okay, so he's diagnosed with HHNS. Okay, so his blood sugar level was very high and that's why he became unresponsive. And for this diagnosis, intubation is not the action, whereas IV infusion of normal saline. Okay, whereas why not 100 units of NPH? Why can't you start with that? NPH, if you give, the action will be delayed, right? Okay, so you can't begin with
Moreover, ma'am,
NPH.
our first priority
Is to
rehydrate the patient.
Exactly. And also that for HHNS clients, mainly rehydration takes the top priority. See, in HHNS clients, they don't have any problem in insulin. That is another aspect. Okay, their insulin is normal. So they don't have any problems with insulin. And also NPH will take more time. That is also another aspect. Okay, but rehydration takes the top priority here. Sodium bicarbonate, in which conditions you can give?
Acidosis.
And acidosis. Okay, so not in HHNS. Sodium bicarbonate in acidosis. Fine. A client with diagnosis of DK is being treated in the emergency department. Which finding would a nurse expect to note as confirming the diagnosis? DK, which one is confirming? Whether it is coma, or you need to think which doesn't happen in HHNS. So you need to think in that way to confirm. So whether it is decreased urine output, respiration and increase in pH, or elevated blood glucose level and low plasma bicarbonate.
Third one, ma'am.
In diabetic ketoacidosis, is there increase in pH or decrease in acidosis? Acidosis means what?
Decrease pH. Sorry,
Decrease
ma'am.
in pH.
Yes.
Okay. See, every word is important. And also remember, if half of the question option is right also, you should not select. Always both side of the questions option should be right. Okay. So whereas, yes, this is elevated blood glucose level and low plasma bicarbonate level. Okay. So that will be present. So decreased pH and decreased bicarbonate. Understand? So if pH is lesser than 6 and all, we go for bicarbonate therapy. Usually for 7 and all, we don't go for bicarbonate therapy. Okay. Yeah. So that's why. So fourth one is the confirming aspect for diabetic ketoacidosis. Okay. Acidosis. The acids are getting accumulated because of fat breakdown. Okay. And therefore the hydrogen ions are getting accumulated here and causing acidosis. Moving to the next one. A client with type 1 diabetes has prescriptions for NPH insulin and regular insulin. Okay, he has prescriptions for both NPH and regular. At 7:30 a.m., the client's blood glucose level is 322 mg per dl. At 7:30, okay? 322. And the client's breakfast tray has arrived. What action should the nurse take? Click on the exhibit button for additional information. When you check the breakfast tray, when you check the exhibit, you found that NPH insulin is 25 units sub-Q twice daily. One is given at 7:30 and one is given at 9. NPH insulin 25 units are given at 7:30 and 9. Regular insulin as per sliding scale based on the client's condition, AC and HS. What is AC? What is AC?
Antisebum before meals.
Before meals and HS at bedtime. Okay. So now we have sliding scale units here and the client has 322, which means that how much is the sliding scale? 12 units, isn't it? So along with this 25 units, so he should be given with this 12 units because his breakfast tray has arrived at 7:30. His time for NPH is there. And also now sliding scale shows 322. So therefore 12 units are also there of regular insulin. So now tell me what's the action? What's the right answer?
Ma'am, fourth one.
Fourth one?
Yes.
Any other options? Any other options? Yes. Fourth one? Yes, very good. Okay, so fourth one is the right answer. So because first one says 25 NPH now and 12 after. No, regular insulin should be given AC before meals, so not after. Okay, so you can eliminate that. Administer 37 units of insulin, that is right, but they have given 25 and 12 units in two separate. No, we are not going to prick it twice. Okay, so that's wrong. Administer 27 units of insulin, 25 units of NPH mixed with 12 units of regular in the same syringe, drawing up the NPH in the syringe first. No, what should be drawn? Short acting should be drawn. And therefore, yes. So fourth one is the right answer. Okay, you get these kind of questions. Okay, surely you get. Yeah, a nurse administered 20 units of NPH insulin to a hospitalized client with diabetes mellitus at 7 a.m. The nurse should monitor the client closely for a hypoglycemic reaction at what time? Hypoglycemic reaction. Think. NPH, what is the peak time?
6 to 14 hours.
6 to 12 hours. Okay. Yes. So
4 p.m.
4 p.m. Very good.
Yes.
Okay. Yeah. 4 p.m. is the right answer. Okay. Yes. So very good. So now a client received 20 units of NPH. Okay. So this is the full form of NPH. Okay. Neutral protamine Hagedorn. So sub-Q at 8 a.m. The nurse should assess the client for hypoglycemic reaction at which of the following times?
5 p.m.
PM.
NPH at 8 p.m.
5 p.m.
5 p.m. Yes.
5 p.m.
Very good. Okay. So 5 p.m. is the right answer. Okay. Yeah. So that was all about today's topic. Any doubts for clarification? Okay. So if no doubts, we'll wind up today's session. Okay. So please practice questions. Keep practicing at least a minimum, even though you are busy, even though if you are having work, at least a 20-25 questions per day. By the time you finish the course, you should be able to practice 75 questions at a stretch. Okay, so that you get the continuity for the exam. Otherwise, by the time you reach 50 questions during the exam, you feel so tired. You don't feel the continuity. you feel like when this exam is going to over. Okay, so and if you get 145 till 145, you have to wait, in the sense that would be more tiresome. So practice 75 questions so that you get used to answer the exam kind. You will be ready to face the exam environment. Okay, keep practicing. See you on Wednesday. Take care.
Okay,
Bye.
ma'am.